Welcome, everyone. Thank you for joining my presentation today. My name is Farnaz Malik, and I'm currently a Senior Technical Advisor on the Data Impact Program within the Data for Health initiative at Vital Strategies. The Data Impact Program partners with country governments to support the use of data for health policy and decision-making. Today, I will be talking to you about incorporating a gender lens in data-driven decision-making. When gender and related data are not incorporated in national health policymaking and planning, we often see long-term outcomes that disproportionately affect women. By not addressing the gender data gaps, we cannot address potential health disparities or inequities. The purpose of my leadership project was to explore how to systematically include a gender lens in the Data Impact Program's technical assistance activities with a primary focus on a training known as the Data Center Leadership Training, which supports public health managers in government to institutionalize and strengthen the use of data in their decision-making processes. The learnings can also be applied to Data Impact's other areas of technical assistance. To do this, I organized my project into 3 stages. Stage 1 was the information gathering stage via qualitative interviews. Stage 2 involves the analysis of these interviews and synthesizing and summarizing the findings. And stage 3 will be to apply the learnings from the interviews to Data Impact's gender-focused technical assistance activities. By evaluating gender-focused activities that have achieved milestones and impact, we can learn the facilitators and challenges to systematically integrating gender data in government processes and policymaking. As of now, I have conducted 9 qualitative interviews with country partners from Argentina, India, Mexico, Senegal, and Sri Lanka, and I have more planned with partners in Kenya and Zimbabwe. I have also interviewed Data Impact team members who have supported these projects and who have helped develop curriculum on strengthening data-centered leadership. And I interviewed Data for Health partners at the Gender Equity Unit within Johns Hopkins University School of Public Health. During stage 2, I analyzed the interviews to pull out key themes around factors such as outcomes and impacts seen at the country level, the key facilitators of successful gender projects, challenges and barriers, and recommendations and considerations for the Data Impact Program when developing technical assistance activities. In one country, the development and dissemination of a gender mainstreaming guidelines that are now required in policymaking within the Ministry of Health led to revision of the current maternal and child health policy, such that all 12 goals in the policy will consider gender. In another, findings from a gender statistics report informed the development of a policy brief on gender-based violence, which prompted the government to formalize structures in various sectors to better support people experiencing GBV. Publicly available health dashboards disaggregated by sex and gender-related factors in another country highlighted differences by gender in certain diseases. While I listened to country partners recount the arc of their gender projects from data analysis to data use and decision-making, I learned about the factors that contributed to success. These included having champions within government advocating throughout an activity, having clear definitions of terminology. What does gender equity mean in that country's context? Starting with the decision-maker's needs and working backwards to identify areas of opportunity, that is, a decision-first approach. Ensuring a gender balance at the decision-making table, such as increasing the number of women represented. And moving beyond just sex disaggregation to consider gendered data that reflect differences, roles, experiences, or outcomes associated with gender. This includes data related to demographics, health and health systems, labor and education, mobility, and human rights. As we learned, the absence of gender disaggregated data can hide inequities and thus bias decisions. One key informant noted that gender inequity doesn't always happen deliberately. Sometimes the inequity happens because of unawareness of the needs. For next steps, I plan to speak to a few more partners and team members to learn about stories of impact and gather more feedback for our work. I will then work with my team to include gender considerations in the current data center leadership training, curriculum, and other areas of technical assistance, such that upcoming trainings in country will encourage government staff to integrate gender data in their processes and their policy making. This will lead to more gender-sensitive policy and programmatic decisions, ultimately advancing gender equity at the country level. Through the story and information gathering phases of my project, I had the opportunity to build on WomenLift's leadership style of both strategic leadership and inclusive leadership by listening to our partners in country who have valuable insights from their lived experiences, to ensure that their feedback are incorporated to strategically develop programs that suit decision makers' needs. I want to sincerely thank WomenLift Health, the incredible leaders in cohorts A and B, my mentoring group, my coach, and my supportive supervisor and team at Vital Strategies. And of course, to the colleagues I interviewed who are integral to these successful gender projects. I look forward to continuing this work. Thank you.